with capacity limits. As millions more vaccines are rolled out, it's going to be critical for patients to help the CDC keep track of the vaccine's effects.
New at 6, Fox 4's Kara Mashik is live from St. Luke's on the Plaza tonight with the easy tool you can use to help. Kara?
It's certainly very important. If you've gotten your vaccine soon, you probably got a big old packet of information like this, but you may not have realized that inside of that there is this sheet. It points you to a smartphone app. It allows you to connect with health officials to keep tabs on how patients do after receiving the shot. Lisa Dressler is ready to see family and enjoy life after getting the COVID-19 vaccine this week.
I'll still mask, but just to kind of go back to Royals games and movies and things like that.
But like many, she was a little nervous about how the shot might affect her.
I kind of freaked out for the first 15 minutes I was sitting in there because you don't know if you're going to have a reaction.
For years, the federal government's operated the Vaccine Adverse Event Reporting System, or VAERS. Anyone who has severe reactions to any vaccine can report it through this system. But this year, as COVID-19 shots hit the market, the CDC launched this new app called VSafe.
It actually will send not only messages about, how do you feel, any side effects, so that CDC can track closely in real time if people are having any issues, but it also can send you reminders like it's time for your second dose.
The ability to track any patient's reactions to the vaccine in real time is critical. While most people have very mild symptoms like arm soreness, if you experience any side effects not commonly listed, reporting it through VSafe will help the CDC investigate.
If there was ever a very severe reaction or unusual, then, it says on the app, CDC may reach out to you to get more information. And so having that ability for the person to give their own experience, I think, is invaluable.
When you log into the VSafe app, you'll enter the date and brand of vaccine you got, and the CDC will follow up with a health survey. All the information collected will also be important in helping COVID vaccines move beyond emergency use authorization to full approval down the road.
It definitely will help to determine, effectiveness as well as safety profile long term.
Now, you're encouraged to use that VSafe to log in your symptoms within 6 weeks of receiving the vaccine. If you have any fever or pain in your arm, most doctors say it's just fine to take something like Tylenol or ibuprofen to relieve that, but you don't want to take anything before you go in to get your vaccination. Lauren.
Kara Mashik live in Kansas City. Thank you.